This morning the Commission has updated the Council on the state of play with respect to the yellow card procedure for the revised Posting of Workers Directive. The Presidency also presented a progress report on the negotiations on the Carcinogens Directive. Good progress has been made, and hopefully the next Presidency will be able to come to an agreement. And also we hopefully adopt 2 sets of Council conclusions on gender equality and on LGBTI. This is very important in the sad days after the Orlando attacks, that homophobia is addressed also at the EU level.
This year, country-specific recommendations invite Member States to focus on increasing employment, strengthening human capital, and improving social inclusion and protection. The Council conclusions are in line with the Commission's approach on social dialogue, notably the priorities on more actively involving the social partners in economic governance and on the role of social partners in EU policy and lawmaking.
Let me develop very shortly on 2 aspects in the skills agenda. That is the skills guarantee, and that is the proposal to revise the European qualifications framework. We launched this idea of a skills guarantee. This means that we will ask Member States for a commitment to put a 3-way approach in place for low-skilled people. First, an assessment to see what are their needs, what is the level of knowledge, what do they know, what do they can. Secondly, a tailor-made package or a tailor-made offer to upskill those people. And thirdly, that it's possible for those people that they can document the newly obtained skills. A second element of our skills package is the qualifications framework. We will improve that and also make it possible that we can use that framework to screen the skills of people from third countries.
On pharmaceutical policy, we would like to give a strong political message that change is necessary in the way the current pharmaceutical system is working. On antimicrobial resistance, we agreed that each Member State should develop by mid-2017 a national action plan based on the One Health approach and in line with the WHO Global Action Plan. We adopted a roadmap to action on food product improvement. We aim to improve the offer of foods by reducing the amounts of salt, saturated fats, added sugars and energy.
Fighting AMR has long been a priority for the Commission following a One Health approach in this area. I am very pleased that the conclusions stress the commitment to improve coordination, in particular through the One Health network. I welcome the conclusions on strengthening the balance in the pharmaceutical systems in the EU and its Member States. Another pressing issue on the agenda was food reformulation. The Council conclusions adopted today are a further step to increase awareness and push for action to improve nutrition at both European Union and national levels.